words that's found in the Bible is the word walk. In the word walk, basically is talking about living together, having life together. And so that's, in fact, in the Bible, the word walk is written 25 times. Sorry, is it 25? 250 times. So that's quite an important thing to do. And what we have seen this morning, for example, is to see that the ladies are dancing a lot more than the men. The reason is because the men's knees are already crooked. Just briefly introduce myself. My better half, she over there, is a retired nurse who just retired this year, so that she gives me some honors all the time. Whenever I have to preach or teach somewhere, she's the second most difficult critic besides God. So be very careful. But I don't look at her anymore because she'll tell me what I did wrong. So basically, she's a nurse and she has the godly one. She keeps me in check, especially when I prepare something. Like last night, I was watching the skiing and she said, "Have you prepared for your talk yet?" I said, "No, I'm watching the skiing." So anyway, basically I've been here in Australia for 56 years and coming to 57 years, and I've been in general practice for this is my 52nd year, and for the last 25 years I've worked part-time because I'm a tent maker, so I've done all sorts of things around different parts of Melbourne and overseas. And I was trained, came from Malaysia, Chinese, obviously came from Chinese school, and then I learned English mostly in Australia. And so besides medicine, she and I were very much into Christian ministry, and that takes up the bulk of what we've been doing for the last 25 years. I used to lead short-term missions around mostly Asia, Africa, and other parts for about 10 years. And other than medical thing, and I was talking to the lady just now that she said she was born when she was very young. I said I was only been 25 years because I was reborn again at 25 years ago as a Christian. So these days I'm mostly doing itinerary preaching around different parts, and also teaching the Bible and writing books on Christianity as well. So coming back to what we have, I'll just briefly show you that is my passion, basically teaching. Let's go to the other slide. The next slide, please. The next slide. Next slide. So let's go to the next slide. That's fine. Basically, that's what my talk today is on the topic of. I just hand this over. You can, if you can't see it up there, you can actually look at the diagram that I prepared this morning. And in terms of what God has given us, one of the most important parts is about how to walk and balance ourselves. And therefore, the strongest and the biggest joint in the body is actually not the hip joint. It's actually the knee joint. And the knee is basically used for walking and balancing. As you can see that if you can't walk, you can't dance, you can't have fellowship, you can't live together. That's why walking is a very important word for that. So if you can't see that, that's fine. I actually want to show it on this, which is much easier. And the knee joint is such an incredible joint that people don't realize that. Because our body is built on bone structure and the rest of it. It is like when you become Christian, the bone structure, the skeleton that keeps you upright is actually the Word of God. And everything else is just the muscles and the tendons. So in terms of what we're talking this morning is about the knee joint. Because of all the joints in our body, in the 52 years as a GP, that the most common problem I see is the knee, more than the hip, more than any other ones. That's why I think it's important to talk about the knee first. The knee is different in the sense that the knee is a hinge joint. Like It's like when you open the door, it's a hinge. Whereas the parts, like for example, the shoulder and the hip is what we call a ball and socket joint, which is quite different. So today I just want to talk basically on the knee joint because it is probably one of the most important joints. And first I'll just talk about the anatomy of the knee joint. You probably can see it up there. So we start off with the most important part is the bone. So we have the bone. The soft tissue consists of the cartilage and the ligaments and the tendons and the muscles and also obviously the blood and the nerve supply. If you look at up there, and you can see that basically we have one thigh bone and two leg bones. And I'm very fussy when people say leg, I say, you mean the leg or the thigh? Because they think the leg is the whole thing. And it's actually quite different. And the interesting thing is that because of the hinge joint, it is actually used for bending, so that any action that deviates from forward and backwards is going to cause trouble. And so that the knee joint basically consists of this bone, but without any cushion. You can imagine just like your car have no disc brakes and just drum on drum, and it's going to cause a lot of problem. So the interesting thing is that to do that, God has created such an interesting cartilage. There are two types of cartilage there. And if you look up there, you can see it there, with the articular cartilage, which is actually, what happens is the joint, the bone is like that, and so that the cartilage is attached to that. Because the cartilage is like the structure in the nose and the ear, and it has a lot of give so that it can rub on each other when you bend the knee, whereas the bone will be rubbing very painful. So the articular cartilage is a very soft cartilage, which allows like a cushion. Yeah, thank you. I'm not used to this, I usually wear the earpiece, and because I like to move my hands. And so the cartilage basically works on rotating that. But if you look at the meniscus, you hear about the meniscus, it's actually also a cartilage. The difference between that and the articular cartilage, the meniscus is a hard cartilage. When you think about the meniscus, if you're not a Christian, I tell you, it's incredible. As a very logical person, I used to teach medicine, and in fact, I was a supervisor for postgraduates and also postgraduate doctors. So I always tell them that God is incredible to invent this meniscus, because the meniscus, as you can see, is like a disc. So on one side or the other, why it's two is because that when you have two there, how the bone can actually move a little bit sideways as well. The meniscus is like this pad in your car. Why I said God is incredible, because if you have a disc pad in your car, you'll be lucky to let it live for 3 to 5 years, and it's gone because it's hard. Whereas God has invented this cartilage, the meniscus, which is this part. Let's go to the next slide. Oops. So basically, if you look at that, the meniscus is a disc. And the interesting thing is that it actually is like an onion. It has 3 different types of soft tissue cartilage in there, not just one type. And the reason why it's incredible, because the outside of it has very little blood supply to allow the toughness of when you rotate your knee. The middle part is a bit softer, but right in the middle of the disc is a soft part where all the blood supply and all the electrical wires or the nerve goes there. That's why when meniscus is torn, the inner ones can heal very well, the outer one cannot heal very well. The reason why it's interesting is that you imagine that it is as tough as a disc pad in the car, except it's alive. And not only that, It's like an onion, which means that it has own circulation around there, its own plumbing, and own electric wires. How in the world are you going to invent something like that? It's almost impossible. And so that not only that, then we have those cartilage. The next thing is other ligaments. And you heard about ACL and all that sort of thing. And the reason why I watched last night thinking about it is that almost invariably, all of us cause problems. We are actually responsible for the damage of our wounds. I don't know what it's called. Okay. Basically, that's the anatomy of it. The next thing are the ligaments. The interesting thing about that is in there, you're going to see the ligament crisscross. The ACL is what we call anterior, in other words, the one in the front. The posterior is the one at the back. And they actually cross over. So if you look at a cross, for example, you will see that the horizontal piece is the posterior of the back. So that's the PCL. The PCL doesn't get torn very easily because it comes from the back. All the trauma we come is the front. So you see that, for example, in the snow skiing, I used to do a lot of snow skiing in my younger days. It has a lot of injury on the knee. That's where the ACL get torn as well. So not only you have the bone, you have the cartilage and the disc pad and the meniscus, but you also find that there are also lateral ligaments and medial ligaments. Those are the ones on either side. The one on the middle, in the front, in the inner side, and the one on the outer side to steady the knee joint. So you have the cruciate ligament and all that. Then on top of that, you have muscles. And think of muscles like when you go to the butcher and buy a piece of meat, you see those white stuff attached to the end. That's where the tendon is. So you find that the tendon doesn't have as much blood supply. When you torn the muscle, the bone is easy to heal. The tendons and the cartilage are very hard to heal. So that's what basically the function is like. The function obviously is to help you to do your line dancing and do all that sort of thing. But why did that happen? There are few things that can happen to your knee joint. Basically, is inflammation, infection, autoimmunity, and degeneration. What can go wrong? Those four things. Very simple. Of course, we think about infection. In the old days, we get osteomyelitis and all that. So sometimes if a person starts to suddenly swell up in the knee and painful and red, then usually you have to make sure there's no infection. And the way to find that, we do a blood test. You can actually put a needle in there, take it out, and check for it. That is not as common. Inflammation is very common. For example, that if you're naughty, you eat a lot of anchovies and all that sort of thing, then you get gout. So we punish what God has given us by doing that sort of thing. And inflammation, of course, can also some exotic problems that cause the knees have those inflammation. Autoimmune diseases are things like, for example, the most common is rheumatoid arthritis. And that's quite different from osteoarthritis because autoimmune means that your body attacks itself. It doesn't realize that it's normal, so it produces certain things to attack it. Rheumatoid is the most common one. We have psoriasis can do that, and a few other things as well. But the most common one amongst all of us here is degeneration, or what we call osteoarthritis. Why does it degenerate? The reason is that when God created the knees, like everything else, He asks us to look after our body. Invariably, all of us don't look after our knees because there's a saying that no pain, no gain. You do not know your good health until you suffer something wrong. And almost invariably, all of us, especially men, we do jump, as I used to say, that when we were 16, we'll jump from 9 foot up, and then down, 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 down. When you get to 60, you jump from there. When you get to 70, I gingerly come down here. And the reason is because what happens is the bones start to wear out. You know what bone wears out is a bit like this. You see a piece of bone is very healthy, slightly yellow color, and then you see one in the desert, it's all white and crinkly. And that is degeneration of the bone. That's why they need calcium and vitamin D and all that sort of thing. So degeneration usually comes from trauma. And so you look at the AFL footballers, every single one of them have osteoarthritis. Everyone who does skiing like me, snow skiing, would invariably, because you are actually driving your body like driving a car with an RPM of 7,500 RPMs. So you're going to cause trouble. And of course, women do that too, kneeling before the boss and doing gardening and weeding and cleaning and all that. So we do a lot of damage onto that. So in terms of finding what's wrong with it, I find that in every discipline, even in medicine as well as in the understanding of God, that there is a lot of breadth, not enough depth of understanding, so that increasingly I see a lot of young doctors who has the breadth of knowledge but no depth of knowledge. It's the same with Bible. We tend to glance over it, we don't meditate on the Word of God and do that sort of thing. History is probably the most important thing. In most cases, 80%, 60 to 80% come from history. But in terms of me, by the history, you can tell how you injure it. So people say, just treat it. I say, hang on a minute. Let's spend 10, 15 minutes find out how and why you got the problem. That's very important because that will bring it to examination. Medicine is very simple. Basically, it's medical detective work. This day, they do CSI straight away. Imagine you go into the scene of crime, first thing you do, CSI. You're not going to find it. I always give this story about a old lady might come to stay with you, and then there was a break-in, and then they lost just a mint vase, nothing else. And they will catch all these murderers and pedophiles and all that, but there's a guy who's an ex-curator in the Louvre. He's like the one who does it. So history is very important. And the second thing after the history is to examine the scene of crime, which is the body. And so that by examination, it gives a very, very good indication what sort of problem a person has. Once we do that, the next thing is, of course, decide to do investigation. One of the things I tell young doctors, even postgraduate doctors, is that don't do the test. The less tests you do, it shows really how good you are. More tests means that you probably don't know what you're doing. Tests are only there for two reasons: to confirm what you think it is, to exclude the things you want to exclude. These days, most of the tests are what I call fishing expedition. They hope to catch something, and it's often you catch the wrong fish. And I see that regularly all the time. So in terms of investigation, there are basically those 4 to 5 types. And the important thing is people don't realize the X-ray. X-ray is still one of the most important things we can do, because the X-rays tells us how strong your bones left behind and how much wearing out there is, because a normal one like this is very smooth surface, but after you use it many times in your life, it loses its smoothness, and that typical X-ray will show you that. The ultrasound only picks up soft tissues like ligaments and tendons, a little bit others, but so people don't realize that, oh, I want an ultrasound, hang on a minute. Do what we need to do. Ultrasound is only for that. You don't routinely do tests unless you know what you're looking for. The next one is called CT scan. CT is unlike the X-rays in the sense that the CT picks up more of the soft tissue rather than the bone structure. So CT is actually not as good as X-ray in picking up the bones. Ultrasound is useless for picking up the bone structure. The next thing is the MRI. MRI is probably one of the most exciting things we have, because in terms of the meniscus, you'll find that the MRI is the only one who gives a very good indication how much damage you have around there. And so out of that, the next thing we do, if there is a problem, we need to fix it. And to fix it, basically we come to medical, surgical, as well as what I call physical therapy. Physical therapy is what most of you are used to. If I got a knee, wear a brace, go and see a physio, osteopath and all that. I have absolutely nothing against that. But the thing is that physio, chiropractor, osteopath are there to help the doctor. Don't replace the doctor. They're not there to diagnose the problems. Very often I see people who have knee problems diagnosed by physiotherapists. Physiotherapists should work together with the doctors. The problem is this, that a lot of doctors don't know much about the knees. In fact, I'm going to give a talk to about 10 doctors in a few weeks' time, and most of them already done their postgraduate. The reason why we don't know much about the knee is this, that when I sit for my final exam as a doctor, I fail on my practical because the knee specialist wants me to examine the knee. I study about the heart, the lungs, I forgot about the knees, so I knew nothing about the knees those days. And you can imagine that it is such an important part we need to know about that. In terms of medical treatment, basically is this, that first thing we say, okay, you got a problem, what we should do? And the thing is that we tend to go to anti-inflammatory straight away. And these days, most people take Nurofen, don't they? Like everything else, everything goes in trend. Nurofen was very good, it was called ibuprofen. You use it for everything else, and then suddenly the gastroenterologist says it's not good for the stomach, throw it out the window. And then suddenly they say it's good now. Every mother, nursing mother, give their babies Nurofen as well. Use Nurofen drops. If your grandmother, you know about that. So people has to be very careful with anti-inflammatory. Most of the anti-inflammatory, we use it for acute and chronic. Acute means something just happened quickly, we need to fix it, and that's it. That consists of things like Voltaren and Nurofen. They're not good for long term, for various reasons. And I wouldn't suggest anyone to take Nurofen or Voltaren for long term. The reason partly is because it loses its effect, it only works a certain amount, and actually can cause damage to the kidney. And for long term, we use basically two of the things that some of you would have known, Morbic and Celebrex. They can be used at long term, but again, you need to monitor it because everyone is different. It might work with someone, it might cause problems with the others, so we need to actually work on that. So Celebrex and Morbic are the ones we use. And of course, there's information that sometimes you're not sure, or there is collection of fluid and it swells up there. Sometimes you put a needle in, and the interesting thing is that the young doctors don't know how to do them anymore. So they put the needle in, take the fluid out and drain it. For example, sometimes my wife also had it, there is a bursa comes from the back, a lump there, we do the same thing. The small one, we don't do anything, we just massage it. The big one, we put a needle into there. Intra-articular injection is a lost art. The reason is because that only orthopedic surgeons and radiologists do them. I would be one of the dinosaurs who still do that. And the thing is that I actually asked a sports medicine specialist that work on my knee, and I said, Chris, he works with the AFL and the Olympic team. He said, maybe I should stop doing it. He said, you can feel things that we can't keep doing it because nowadays they rely on ultrasound and CAT scan to do intra-articular injection. I tried to show the doctors how to do it. They don't want to do it because they've never done it before. I said, it's very good. It comes, God create your hands to feel things. And my hands can feel your feces in the tummy. I teach them how to do that. They don't know how to do it. So the hands is like a cat burglar, we can feel things. So we do intra-articular injections, and it works extremely well for people. In fact, the talk we had in the park with the walking group, where we met pastor there, immediately after that, two of them came to me and we fixed it with just one injection. So intra-articular injection is very good for tendon damage, and people who are waiting for knee replacement. Because coming to about knee replacement, arthroscopy, of course, that came in the 70s, initially used for the stomach, but nowadays you use it for everything else. Arthroscopy basically just put a telescope in there, find out what MRI cannot even show, and then visually look at things and decide what to do with it. It's used for treatment, it's used for diagnosis, and used for cleaning out damaged meniscus or whatever to do. And of course, that knee replacement is the next thing we're going to talk about. So, I have got pictures there somewhere about the artificial knee. To have an artificial knee, these days we use titanium. There are other things that are coming out nowadays, zirconium, which they use by the dentists to use that, but the thing is still not coming. One of the things that I find in life that the more you know about a certain subject well, the more you realize there must be a creator God somewhere. So the thing is that when you talk about the knee replacement, like all things, do not have operation unless you really need it. And then on the other hand, you get like everyone, some people will say, I don't want to have this operation. If I recommend you, that means you really need to consider seriously to have it. We won't recommend it unnecessarily because us Christian doctors don't go for this one. We do it when you need it. So the interesting thing about the knee is this, that generally I say to people that if you can walk 1 kilometer, don't have the knee replacement. If you find that you can only walk from here to the door in severe pain, have the knee operation. The reason is this, that the knee replacement advancement is continuing there. Up until a few years ago, an artificial knee lasts for between average only 10 years. Some lucky ones can go up to 12 to 18 years, but that is because of various reasons. They look after it, they do exercise, they go to Pilates, they do the line dancing and the lion dancing. Is it line dancing or lion dancing? I think it's lion dancing. So basically, you do that sort of thing. And the thing is that because why does it only last for 10, 12 years? Look at this way. They actually have to chop off part of the bone and insert things onto there. Where it weakens is between the titanium, that original bone, and that is the way of problems. In the skiing, for example, the other day a lady broke her legs because as she went down, the titanium knee twisted around the two leg bone and break the leg bone, because that's where between the the titanium and the natural bone to do that. In the past, we used steel replacement. That's when you go through the immigration, you get and you got that. The reason good about titanium is a lot stronger than steel, and it's a lot lighter than steel, so you don't have to carry 20 kilos to walk. So it's much easier to do that. These days, they tell me, I don't know for sure, but I speak to some of the orthopedic surgeons, and they will say that it can last between 15 years or more now, the new ones. The reason why you don't have knee replacement unnecessarily is this, that over the 52 years, I've seen so many people with bad knee reconstruction. The reason is this, that because you can never produce a meniscus. You can never produce the ligament they have. You can still do it because the ligament is alive. You can't put a live ligament back. So the thing is that it's almost impossible to do that. And the thing is that when you do operation nowadays with the robotics, it makes a lot of difference because they measure individually the shape of your knee and the way you walk and all that sort of thing. Previously, they do your new knee is the same as that one. It doesn't work that way because it has to be individualized. And so invariably, I would say roughly from the top of my head that if you have bilateral thumb, meaning that both knees done, usually you might have 80 to 99% good on that one. This one 60% or worse. So the thing is that when you have a knee replacement, it will never be the same as your original one. You cannot feel it, your tension is different, you always feel you don't have the movement that you have. So that unless you really have a lot of pain, don't have a knee replacement. And so at my age, I've been told that I need a new knee for my right knee. I go for the walking group from time to time. I can still walk 5 kilos, so I want to get it done. My mother had first one done at 87 and second one at 89. So if you're 75 like me, you get it done now. At 90, you're going to redo the same knee again. So wait a bit longer before you do that. And people who need knee replacement, who doesn't want a knee replacement, that's where I give the intra-articular injection. The intra-articular injection that I give, I regularly get people send me for me to do it, because when I do it, because I charge the Medicare, which is $80, you go to the specialist, consult $300, go to ultrasound CT guided, and then put the injection, cost you more than $1,000. So the thing is that, and you have to book to see them, you come in to see me, I do it in 10 minutes. And just a look at anesthetic. And the reason why you do that is intra-articular injections, injecting something in your knee to lubricate it. And because it's derived from natural products, it lasts, average, they say, between 6 to 12 months. I average do about between 6 to a dozen a year. And some people have more than one. And my success rate is 99.99%. And the thing is that it lasts between 12 months to 2 years when I give it. Because I feel exactly, I know what angle is 15 degrees one way, and then this and that, and get it in. So it usually lasts that way. But saying that, don't come and see me, go and see a doctor. The important thing, therefore, is do it only when you need it. And the thing is that it comes to the next part, prevention and management. Any operation doesn't fix your problem. We cannot save ourselves, God saved us, but we have to be active participants in what God does for us. One of the things that she and I have noticed over many years is that we regularly get people, when I preach, people come up to pray. They always want something about their grandchildren, their job, and the physical thing, which is very important. But you look at Jesus, whenever he spread the gospel, he always does the healing. When he does physical healings, there's always preaching the gospel and the spiritual healing. So important to get your spirit right when you do that. And in terms of prevention, always do exercise, do your lion dancing, do your Pilates, go swimming. We recommend the best exercise is swimming and walking, not running. Because running, you can adjust quite a lot around there. And certainly physiotherapy or osteopath, chiropractor all helps to some extent. The important thing when you go to them, don't overdo it. The important thing too, in terms of exercise, we say that do whatever exercise you do until you get an ache. If there's no ache, you're not actually developing the muscles to compensate the weak knee. But if you reach the pain threshold, that means you've overdone it. So if you walk around, you feel, oh, aches a bit, that's good. But don't push further to pain, because your lion dancing is not going to give you a lot of aches. So you need to do a little bit more than lion dancing. Lion dancing is social. So you can clap your hands for that and sing miyam miyam. And so that misiam misiam. And so that's very important. Have aches but not pain. But also the thing is that in every situation, wherever the mission of what we do, pray and let God direct you to discern what is best for your treatment, for yourself. God will always show you something of that. So of all things, let us give thanks to God this morning for what He's done in us and help us to see that we need to look at ourselves physically, emotionally, and spiritually. Yes? We're not talking about hip today. I've got no time to talk about hip. Don't you know the only way to stop me from talking is to give me gastro stop? Okay, any questions? Don't be shy. I'm shy too. She laughs.
You know, I had aspiration done like 10 days ago. So, can you hear me, mate?
Yeah,
So loud. I have aspiration done like 10 days ago by a radiologist, and she aspirated about 27 veins out. And at first I thought, oh, after aspiration I'll be fine, but I'm not fine. I have pain on my inner part, on the lateral side of my knee, and I have to walk very carefully. If not, you'll hurt. If I do certain decision, you'll hurt me. So what is the aftercare for that?
It comes back, number one, is a history. Why do you have expiration?
Went for X-ray and then they show that.
Was that because of pain, swelling, infection,
No, I
arthritis?
was walking funny. Then I went to see my GP. I said, discomfort.
Yes.
Then she sent me for ultrasound.
Which found fluid there?
And then they found fluid.
Where was the fluid? In the top, above the kneecap, below the kneecap, or behind the knee?
I think it's underneath because the radiologist put a needle in.
From the front?
Yeah, from the lateral side there.
From the lateral side there. And that usually means what we call effusion. It depends. Was your swelling more above the belly button, above or below the kneecap, or at the back? Because it makes a difference.
Not at the back, but it doesn't show really overly swollen.
So okay, so it's not overly swollen. Was it red hot?
I think.
So why did you have it done if there's fluid there? Was that pain?
Not pain. Not.
So after that aspiration, is the pain worse? Is it better?
All the time, it's not much pain.
Okay. Basically, when there's what we call effusion in the knee, I don't usually aspirate. The reason is because that the body will absorb itself. But when it's a lot, then you do aspiration. Aspiration means that you put a needle in there, you open a wound, there's a potential for infection. And also that when you put a needle to aspirate it, you're actually taking the fluid out, but you also take some lubricant out, which means that there's a chance that the two bones will strike against each other a little bit, causing unnecessary pain. I'm not saying in your case, but generally mild to moderate swelling of the knee, if that's not infection, we usually just put a brace on it and then put them an anti-inflammatory and then wait on it. Sometimes when it's so bad, we put aspirate it. But if I aspirate it, I always tightly bandage it so that it don't move around. But you need to check with your doctor to see whether you need anti-inflammatory tablets just for a week or two.
But she injected hydrocortisone.
The hydrocortisone is the strongest anti-inflammatory we ever had. And for people who need knee replacement, you don't have that because it causes long-term problem. For you, the hydrocortisone is very good to reduce the inflammation. Again, we only do that if you need to absorb to stop the aspiration, to stop the fluid collecting. And when I inject, take aspiration, I always put cortisone in there for that purpose. Any more? That's it.
Why does the fluid collect at the back of the knee?
Around the knee, which you can't see here, basically between the ligaments and all that, there's a cover. And it's like a sag. You know how eggs have a sag? Everything has a little inner and outer layer sag. So basically, it's at the back there. And what happens is that sometimes, through arthritis, through trauma, the loses its effect. It comes into like a little balloon, and fluid collects. That what we call Baker's cyst. And that's the type that usually have that. Fluid collection is either due to infection, inflammation, or trauma.
So when do you usually decide this aspiration?
The doctor decides. And and discuss with you. It's like yesterday I'm giving this 17-year-old very important advice, but the father was there. No, everything. I said, that's fine. But important thing, that's why I want to talk to people about most important thing. In fact, in a few weeks time, I'm going to talk to a number of experienced and non-experienced doctors about the challenge of medical care in the 21st century. When to intervene, when not intervene. Spend more time on history, spend more time on examination. Don't just keep doing tests all the time. So it really depends what it is, why it is, and whether it needs anything. Because, for example, if you put braces on the knee, that's good for fluid, it's good for tendon damage, but useless for meniscus tear, because that's a different problem altogether. That's a break problem. So when I had the meniscus tear, I know a lot of well-meaning people ask me to put braces on that. I say, look, I don't need it. I'll try it. I know my medicine.
What about bulging meniscus?
Sorry?
What about just a bulge?
The meniscus doesn't actually bulge because imagine a dish that you have looks like an onion. It looks a little bit like plastic and rubber together. So it doesn't actually expand. It's very tough. And it's also spongy and it's very good cushion, because imagine that those ski jump, they can jump 60, 70 meters down. It takes a lot of tension on that. So it doesn't bulge at all.
There's a lot of, in marketing, they ask you to buy fish oil, glucosamine, and so on and so forth. Are they useful?
Generally, the first thing when people ask me, and I actually spoke to 2 of the postgraduate doctors recently about that, and I said, the important thing is that it is all about money and politics. The reason is not so much just the pharmaceutical company. In every discipline, the church included, and what happens is that we change the way we do things. In most universities, when they have to do anything, they need to have a PhD group of people doing it. So if in the past you can have a research 10 years before you produce results, these days, every university, the PhD candidates has to produce a result at the end of the year. So what happens is that those things are usually what we call statistically insignificant. So what happens is that when they do a research on anything, whether it is, because by the way, I'm also on the ethics committee for 27 universities of Christian University, Australia-wide. So I get a lot of pastors comes before us and deal with situations like that. And it's very important to realize that people need to think carefully before they do anything. Because any of these tests, any of these things you talk about, glucosamine, evening primrose, turmeric, glucosamine, all these things, statistically, roughly about 4 to 5 to 6% of them works well. That is good, because actually some people do work very well, glucosamine or turmeric and all that sort of thing. But also in any of these investigation tests, when we do what a double-blind study, you know what a double-blind is? When you have to say a new drug's coming in, you want to see whether it works or not, you try the animals first, then you separate out and say, we're going to try it on human beings now. This half take the real stuff, this half take the placebo. They don't know it, but invariably out of this group of placebo, 4% says that they feel better. That happens every single time. So you have to be careful that all these things do help some people, and we all know that it helps, but it's not a panacea for everything. But if you have knee problems, certainly I'm starting to take magnesium because of my age, glucosamine, or all that sort of thing, and maybe it helps a little bit. It also helps a little bit.
See, I have total knee replacement of both legs.
Both knees?
Yeah, both knees. And as you say, this thing will last about 10, 12, 15. I don't know how long it will last. I was just wondering what will happen at the end of, let's say, 12 or 15 years. Do I have to go for a second surgery or?
That depends on a lot of things. First, it depends on your age.
Because I did this about workplace around about 9 years ago.
And may I ask how old you are now?
At present, I'm 83.
83.
I did it in our age of 70.
So the thing is that if you don't have a problem, don't do anything. Leave it alone unless it gives you trouble. Because so just enjoy what you're doing. Make sure you don't overdo things. Do your exercise, do your lion dancing, and do all the other things, swimming, walking, but don't walk beyond your capability.
That's only walking.
Yeah, if you can walk.
Like exercise, not heavy.
I think whether it's pre-operative or post-operative, yours is 9 years. If you can walk 1 kilometer, don't do anything to it. Just enjoy what you have got. You can speak louder. I'm not that loud.
No, it's okay. Actually, if you notice, most of the congregation here is of that age, okay? So I think most of us will have degenerative osteoarthritis, okay? So what is your advice to us to keep our knees safe, to protect the knee from now onwards? Because a lot of people, as the police says, take all those things to help. And I think you can give us some advice on how to protect our knees so that it won't go for further damage, Because some of us don't realize that you go to some exercise group, they never tell you the injuries that you will experience, all right? And I think...
You want to answer that as well? Basically, as I said, I think on the screen there, I said, the important thing is wisdom and discernment. Whatever we do in life, discern what is best and ask God what is best. Your body always tells you what not to do and what to do. And because that when it comes to the pain, you know that's something you have done wrong. Therefore, prevention is very important. In terms of exercise, you can't beat swimming. The reason is because in swimming, what happens is there's no gravity. So therefore, you don't put a lot of stress on it. Even walking can cause a lot of trouble. For example, if anyone has a knee problem, you find that walking on soft surfaces like the grass is better than the concrete. So I go for walks with them from time to time. They walk on the path, I walk on the grass. And because it's a bit of gift with that. Shoe wear is very important. So that, for example, nowadays as we get older, you find that the shoe sizes change because we have to go wider instead of longer. So it gets wider and wider. So for our age, we should wear wider shoes. And the thing is that the knee and the hip are together because all this works together. So sometimes knee pain, by the way, all knee pains are not linked to knee, sometimes from the hip. Sometimes hip pain comes from the knee. Recently I saw one that was sent for a hip replacement and the doctors in my surgery, 3 of them said it. I was on holiday, I came back, I examined him, took the history, examined him and said, your problem is in the back. You get the surgeon to replace your hip, you're still going to go back because it comes from the back. So exercise is important, shoe wear is important. These days, when I go for walking, I make sure I get very spongy shoes. So give you a gift and all that. In terms of what daily thing to do, you need to train your husband and to do more housework so that you don't have to bend down and squat down so often. Gardening is fine. These days, I sit down, I have a pad on there or a seat to sit on so that I don't have to squat down. Because squatting is probably one of the worst things you can do with your knees. Because you are actually doing what the hinge joint is doing. So that's important to do. And so that's walking always because the hinge joint, be careful of twisting. Uneven ground is not very good. Physio, Pilates, all those things are all very good, but within reason. The best exercise is to think before you jump.